Hey, what up all my tooth doctors and doctresses? Welcome to another episode of the Tooth Factory. Today we're going to learn about hypertension, antihypertensive drugs, and blood regulation system. So get your pens and papers out and let's go. Make sure you like, share, and subscribe, and let us know how we can improve in the comments below. Alright, so let's dive into the Tooth Factory's lesson on hypertension. We're going to look at all the hypertensive drugs in a classification, a mechanism of action of all those drugs, blood pressure regulation system by the body, that includes the sympathetic nervous system and the renin, angiotensin, aldosterone system. We're going to take a look at an insight into the other forms of the drugs for hypertension and the guidelines and management. Let's begin by defining what hypertension means. It is defined as a sustained elevation of systolic and diastolic blood pressure and represents a significant risk factor for the cardiovascular and renal disease. This is the textbook definition. All it means is that the blood pressure at a higher scale should be sustained for a long time and should provide risks for cardiovascular and the kidney. Here are the new guidelines. It's divided into systolic blood pressure and diastolic blood pressure. The normal is when it is less than 120 over less than 80. Elevated is when it is 120 to 129 over less than 80. Stage 1 is when it is 130 to 139, but diastolic must be between 80 to 89. Stage 2 hypertension is when it is 140 or more over 90 or more. Hypertension crisis is when it is 180 or more over 120 or more. Let's talk about the blood regulation system. It is how our blood pressure reduced turns to blood pressure increased by bodily functions. There are two types of responses that are responsible for this. First one, when blood pressure is reduced, an increase in the sympathetic response is involved. There is a separate video for sympathetic and parasympathetic responses, but all in all, it affects the adrenergic receptors, that includes alpha 1 and beta 1 specifically. When the sympathetic response in alpha 1 is agonized, there is an increase in the peripheral vascular resistance, which is vasoconstriction. And when beta 1 is directly agonized, the cardiac output increases. With both in mind, the blood pressure increases. Now, the other response is on renal blood flow. Because of reduced blood pressure, our renal blood flow affects and increases renin. Because of renin, angiotensin 2 increases, because of which aldosterone increases, and due to which there is an increase in sodium water retention. This will lead to increase in blood volume, leading to an increase in blood pressure. Or, when blood pressure is reduced, renal blood flow is affected and decrease in glomerular filtration results. Because of this, a response with an increase in sodium water retention and brings us back to increase in blood pressure. Now, this chart is important because many of the antihypertensive drugs act on this chart. Therefore, we'll come back to this later. Alright, let's take a look at antihypertensive drugs. During hypertension, we are to prescribe diuretics, sympatholytic drugs, angiotensin converting enzyme inhibitors or ACE inhibitors, angiotensin receptor blockers or ARBS, and vasodilators. Among these groups, number 1, first line of treatment is diuretics because it has effects on sodium, potassium, calcium. Hence, it reduces the sodium water retention and mineral content, reducing the blood volume. It is further divided into carbonic anhydrase inhibitors, loop diuretics, thiazides, sodium channel blockers, and potassium sparing. Carbonic anhydrase includes acetazolamide. Loop diuretics includes all the furosemide, butanide, torsemide. Thiazide includes hydrochlorothiazide. Sodium channel blocker includes amiloride. Potassium sparing includes aldosterone and also spironolactone. Now, we'll take a look at the sympatholytics and vasodilators later. Angiotensin converting enzyme inhibitors includes captopril, enalapril. Their job is to increase vasodilation, therefore reduce aldosterone-induced sodium retention, hence reducing the cardiac output through the sympathetic nervous system. Angiotensin receptor blockers, or ARBs, includes losartan and candesartan. Same job, increases vasodilation, reduces aldosterone activity, hence less sodium water retention and less blood pressure. Now, let's take a deeper look into all the diuretics and where they act and how they act. Alright, let's take a deeper look at the diuretics and their concept. First, a diagram. This is the glomerulus, through which all the content gets into the excretory system. This is the proximal tubule, through which descending loop generates and ascending loop generates. These are the Henle loops. After which distal convoluted tubule comes, and then collecting duct, and through that the urine comes out. Now, the purpose of diuretics is to reduce the water retention, therefore reducing volemia, decreasing the blood volume, and therefore increasing the urine output, leading to an overall vasodilation, causing reduction in blood pressure. Now, we mentioned a few groups of the drugs. Let's begin with that. Number one is carbonic anhydrase inhibitors. That includes acetazolamide. It works on the proximal convoluted tubule by reducing the reabsorption of HCO3s, therefore reducing blood volume. This is where the HCO3s get excreted and not reabsorbed. Descending loop doesn't have much function, so let's get on to the ascending loop. This is where the loop diuretics help. These are the most potent diuretic drugs present, such as furosemide, butanide, torsemide. These reduce the resorption or reabsorption of sodium, potassium, and chloride, thence decreasing the blood volume. Now, it's important to keep in mind that potassium is a very important mineral. We'll come back to it later. Moving on to the distal convoluted tubule, thiazides work here, which is hydrochlorothiazide. It reduces the reabsorption of sodium and chloride. Again, note that potassium is not present in this. Increase in excretion of sodium chloride, therefore reducing the blood volume, and straightforward reducing the blood pressure. The collecting duct also has a group of drugs that help, such as sodium channel blockers and potassium sparing diuretics. Now, sodium channel blockers such as amiloride are very important, in which sodium is blocked from being reabsorbed and excreted through the urinary tract. Now, potassium sparing diuretics. Now, I'm going to spend a little bit of time on this. Remember when I said that potassium plays an important role, because when it reduces from the blood, it creates hypokalemia or acidosis, and this can be fatal. So we have a group of drugs that works on potassium sparing. It leaves the potassium as is, lets it come in the body, but prevents anything else such as sodium chloride. Therefore, aldosterone saves potassium but excretes sodium, therefore prevents hypokalemia. Now, last two groups, sympatholytic and vasodilators. Sympatholytic are divided into direct acting, centrally acting alpha-2 agonist, and indirect acting sympatholytics. To understand the concept behind these drugs or sympathetic system, we have a video on sympathetic nervous system and parasympathetic nervous system that you may visit. Now, explaining direct acting, we have beta blockers and alpha-1 blockers. Beta blockers includes ace-butylol, atenolol, carvedilol, and propranolol, timolol, and so on. Alpha-1 blocker has all the zosins such as prazosin, terazosin, doxacin, alpha-zosin, and so on. Now, direct acting will directly act on the adrenergic receptors beta and alpha-1. By that, they will block their action and reducing the sympathetic response on the heart and peripheral nervous system, therefore reducing the cardiac output and causing vasodilation, leading to a reduction in blood pressure. These are direct acting. Centrally acting alpha-2 agonists. Now remember from that last video, alpha-2 agonists. Alpha-2 works opposite to alpha-1. When there is an oversaturation of adrenergic response, alpha-2 works by reuptaking all the sympathetic neurotransmitters, therefore reducing the effects of alpha-1. So, alpha-2 decreases peripheral vascular resistance and blood pressure. This drug is called clonidine and alpha-methyl dopa. to understand this concept, I'd refer you to the sympathetic and parasympathetic video again. Third group, indirect acting sympatholytics. Alpha-methyl-dopa, resorpine, and guanethidine. These act on the nervous system, the synapse through which the neurotransmitters of the sympathetic system works on the adrenergic system. Again, same video. Now, I'm going to bring you back to this for a second, the blood regulation system, where decrease in blood pressure increases a sympathetic response. This is where the sympatholytic drugs act, by blocking the beta and the alpha, or indirectly assisting these two by acting on alpha-2, or resorpine or guanethidine acting on synapses. Ultimately, it will prevent the increase in cardiac output, prevent the peripheral vascular resistance, and prevent the increase in blood pressure. This is the concept behind blocking the blood regulation system at the sympathetic level. Now, since we're here, I'm going to take you down to the renal system, where angiotensin II and aldosterone are very important in increasing the sodium water retention for increasing the blood pressure. Remember, the angiotensin II converting enzyme is blocked. This is where there is an inhibition. Therefore, no angiotensin II, no sodium water retention, no increase in blood pressure. Another one was angiotensin receptor blockers that are inhibited here. Therefore, no aldosterone, no increase in sodium water, no increase in blood volume, and no increase in blood pressure. These are the rest of the groups, and I'm going to take you back to the vasodilators groups to finish. Vasodilators, divided into calcium channel blockers and directly acting vasodilators. The name explains itself. It prevents vasoconstriction by causing vasodilation. The calcium channel blocker will decrease the intracellular calcium, therefore causing vasodilation and decreasing cardiac output, such as nifedipine, diltiazem, verapamil. Now, nifedipine acts directly on the heart, while diltiazem acts on the vessels. Directly acting vasodilator has three different sections. Number one, dilation of arteries and veins during emergencies. Number two, decrease direct arteriolar precapillary resistance, basically vasodilation. And third, decrease precapillary resistance. All in all, reduces the blood vessels tension by decreasing blood pressure. Alright, so we went through the antihypertensive drug classification, the mechanisms of actions, the blood pressure regulation, and in inhibitory manner as well. We took a deep insight into the other drugs and went through the guidelines and managements. Hope you learned something new and you know where to find these documents.